right, on this slide today, we're going to be looking at the gluteal group, or the Gluteus Maximus, the Gluteus Minimus, and the Gluteus Medius. Of course, the Gluteus Maximus is the most superficial, underneath the adipose tissue in the buttocks region. It runs kind of obliquely from the coccyx, the sacrum, and the posterior iliac crest to the ischial tuberosity and the IT band. We can see that in our illustration right here. If we were to hide that muscle, which is the strongest of the three, we can see, oops, I'm sorry, didn't mean to isolate it, I meant to hide it, so let's hide that one. Alright, so after we go a little bit deeper and a little more lateral, we will see the Gluteus Medius. It's illustrated right here. We can hide that one. Deep to the Gluteus Medius is the Gluteus Minimus. Hardest to access, but nonetheless is still there. It's actually the one that attaches on the anterior aspect of the leg, which can aid in medial rotation and extension of the hip at the coxal joint. Alright, so let's actually come back. If we think back to our anatomy and information, any muscle or muscle might be an opposing force we may think of as an antagonist. So within this region here, we are looking at the Gluteus Minimus and the Gluteus Maximus as antagonists to each other, because the Gluteus Maximus will perform lateral rotation and extension. Let's look at that right quick. Get all my muscles turned back on here. So let's look at the actions of the Gluteus Maximus for a minute, so we don't get ahead of ourselves. So the Gluteus Maximus, their illustration that's illustrated, or it's glowing here, is more of a vibrant color. All the fibers are going to extend at the coxal joint. So if we use our line of pull, and we saw how anything closer to the spine is going to be our origin, anything more distal or further away is going to be an insertion. It's going to be more mobile to where the ones that are closer, if we remember back to our line of pull slide, it's going to be more mobile, insertion, origin is going to be more stable, so non-mobile. Alright, so all fibers going to extend at the coxal hip for the Gluteus Maximus. We've also got lateral rotation, because we can see how that would constrict or contract, and it would bring that femur out laterally. We've also got abduction at the coxal joint, but it's also going to do adduction. If you look at the lower fibers of the Gluteus Maximus, that's going to perform a deduction, to where the upper fibers are going to perform a abduction. Big distinction between the two. One reason it can also be an antagonist to itself from a mobility standpoint, or a kinesiology movement standpoint. Alright, let's hide that one, and let's look at the Gluteus Minimus. If we once again were to use our line of pull, we could see that our Gluteus Medius is going to do abduction at the coxal joint. All the fibers are going to flex at the coxal joint. It's going to medially rotate. It's kind of hard. Let's go ahead and make this where we can see it. That gives us a little bit better understanding of why the actions are what they are for the Gluteus Medius. So we can see how it's going to abduct. Makes complete sense. We can see how it would flex, because those fibers here on the posterior side, flex on the anterior side, extend on the posterior side. Since the fibers here would flex, the posterior fibers here would extend. And the laterally rotation, we can tell that since it's attaching out here on the femur, it's going to rotate that femur on the lateral aspect. Alright, if we are to hide that muscle now we're looking at the minimus. Let's isolate it as well so we can really see it. Pretty close to the same, little smaller, a lot deeper and more lateral. We know that it's going to abduct at the coxal hip. It's going to medially rotate at the coxal hip. So this is our coxal hip right here, right, just for clarification. And it's going to flex at the coxal hip for all three fibers for the Gluteus Minimus. I always like to think about Gluteus Maximus is the biggest, Medius is more lateral, and the Minimus is the most minimum you can really get to, because it is so deep. Now, I'm going to leave that for our slide for today, because we're going to use this slide on multiple courses and information. But that'll start us to thinking about not just would the rotation happen in the femur, but if you think about it almost kind of like from a reverse action, and the femur was stabilized, then the sacrum, the coccyx, and the pelvic would have to do some sort of mobility as well, right? If the leg were stationary or planted. So in a situation like this, if those muscles were very taut or very tight, they could perform a posterior tip pelvic in a situation like that. But what if we start to look at the fibers that are the antagonist, being the flexors, how if they were very tight, how it can pull the pelvis forward because the gluteal region wasn't very strong. So we'll look at that in a little bit later in a couple more lessons and a couple more slides, but that's going to get our mind to start thinking about how we're going to look at taut muscles versus weak or underdeveloped muscles. Thank you.